All right, let's dive into something maybe a little delicate today.
Okay.
We're going to be talking about laser therapy for, anal fissures and hemorrhoids.
Oh, interesting.
Yeah, you sent in some really fascinating research on this,
Right.
including a study from Brazil, of all places,
Wow.
and a whole bunch of articles from medical journals. So
Yeah.
let's unpack all this.
Okay.
It's definitely a sensitive topic for a lot of people,
Yeah.
but we're just going to break down the science here.
Right.
See if laser therapy could be a good option for these conditions,
Sure.
which, let's be honest, are really common
Very common.
and can be super painful. So
For sure.
let's start with the basics, I guess. What exactly an anal fissure?
Well, it's basically a small tear
Okay.
in the lining of the anal canal.
Ah, okay.
And it causes a lot of pain,
Yeah.
especially,
When you're going to the bathroom.
during bowel movements. Exactly.
Right. The sources you sent in mentioned something called a pain spasm ischemia cycle. That sounds pretty intense.
It does.
What's going on there?
So basically, when that tear happens,
Yeah,
it hurts, obviously.
of course.
And that pain causes the internal anal sphincter muscle,
Okay.
which controls bowel movements.
Right.
It causes that muscle to spasm. And that spasm reduces blood flow to the area.
Okay.
That's the ischemia part.
I see.
And then because there's not enough blood flow,
Yeah.
it can't heal properly.
So it just keeps hurting.
Exactly. It's a vicious cycle,
Ugh. So your body is basically working against itself
pretty much.
and making the pain worse.
Yeah,
No wonder people are looking for better treatments.
for sure.
So what are the usual treatments that doctors use now?
Well, there's a few different approaches.
Okay.
We can start with the more conservative stuff you can do at home.
Like what?
Increasing fiber intake is a big one.
That makes sense.
Softer stools, less strain, less pain.
Right. Right.
Warm baths can also help to
Right.
relax the muscle.
Yeah.
Actually, one of the articles mentioned
Yeah.
that overusing a bidet could be a cause.
Oh, really?
Yeah, too much of a good thing, I guess.
Wow. Good to know.
But anyway, if those things aren't enough,
Yeah.
then you might move on to medications.
Okay. Like what?
Topical nitrates can help to relax that sphincter muscle,
Okay.
but they can also give you headaches.
Ugh, yeah. Not fun.
There's also Botox injections.
Oh, wow.
Yeah, they basically paralyze the muscle,
Okay.
which can break the pain cycle.
Right.
But there's a chance of temporary incontinence.
Oh, wow.
So that's a risk to consider.
That's a serious side effect.
It is.
So is surgery the last resort then?
It often is, yeah.
And what do they do in the surgery?
It's called a lateral internal sphincterotomy.
Okay.
They make a small cut in the muscle
To relax it.
to reduce tension and allow it to heal.
I see.
It's very effective,
Okay.
but there is that risk of incontinence.
So it's kind of a tough choice.
It can be.
Weighing the side effects against the relief.
Right.
So let's get to what we're really here for.
Okay.
Laser therapy.
Sounds good.
This is where things get really interesting to me.
Yeah.
So what's the big deal with lasers in this context?
Well, what's fascinating is that laser therapy doesn't involve cutting or removing any tissue.
Okay.
It's much less invasive.
Okay.
Specifically, we're talking about high-intensity laser therapy, or LFT.
LFT, okay. But how does light heal a fissure?
Mm-hmm.
I mean, it sounds almost too good to be true.
Right.
Like, is that really possible?
It might sound like science fiction,
Yeah.
but it's based on real science. So LFT uses specific wavelengths of light
Okay.
to stimulate healing at a cellular level.
So how does that work?
Have you ever heard of photobiomodulation?
What?
Photobiomodulation.
Do you have to break that down for me?
Okay, simpler than it sounds.
I hope so.
It basically means using light to influence biological processes.
Oh.
So the laser light targets an enzyme in our cells called cytochrome C oxidase.
Cytochrome C oxidase.
Yeah, and it's located in the mitochondria.
Right, the powerhouses of the cell.
Exactly.
So what does this enzyme do?
It's particularly receptive to certain wavelengths of light. So when it absorbs that light energy, it triggers a bunch of things that promote healing and reduce inflammation.
So the laser is kind of like jump-starting the body's natural healing system.
That's a great way to put it.
Using light as the energy source.
Yeah.
Cool.
And that Brazilian study you mentioned, that really dives into this type of laser therapy.
I'm so curious about that.
Okay.
What did they actually do in this study?
So they had 38 patients in Brazil who had anal fissures.
Okay.
And they treated them with LFT.
In a hospital?
No, it was all outpatient.
Oh, okay, that's good.
No hospital stay needed.
Right.
Much more convenient.
Yeah, for sure. But did it actually work? Like, did the lasers make a difference?
The results were pretty impressive.
Okay, tell me more.
They measured pain using a visual analog scale, or VAS.
VAS, okay.
Where patients rate their pain from 0 to 10.
Got it.
Before treatment, the average pain score was 4.1.
Ouch, that's pretty bad.
Yeah, that's significant pain.
Right.
But after 60 days of LFT, it dropped to just 0.1.
Wow, that's incredible. From 4.1 to 0.1.
Yeah.
That's almost unbelievable.
That's a huge improvement.
What about, the elephant in the room here?
What's that?
Incontinence. We talked about the risk with the other treatments.
Right.
What about with the laser therapy?
That's the best part.
Okay.
None of the patients in the study experienced incontinence after the laser therapy.
Okay, now I'm really interested.
Good.
So this one Brazilian study is showing some really positive results.
It is.
But is this like a fluke?
Yeah.
Or is there other research that backs this up?
There are other studies.
Okay, good.
And they paint a similar picture. Well, for example, there's a study from 2015 that used a slightly different laser technique called CO2 laser fractional.
All right.
And they also found improvements.
In what?
In pain, bleeding, even constipation.
Wow.
And get this.
Yeah.
There were no recurrences after a whole year.
A year? That's amazing.
Yeah, so different laser, but still really promising results.
Wow, so it's not just a one-off thing.
Yeah, no.
What else is out there? I'm really eager to hear more.
Okay, well, there's another study from 2016 that directly compared laser therapy to the traditional surgery.
The sphincterotomy thing.
Exactly.
Yeah. Oh.
And they actually found that laser therapy had better long-term results.
Wow, really?
Yeah, and fewer complications.
Better than surgery.
That's what the study found.
Wow, this is sounding better and better.
It is encouraging.
Anything else?
There's also a review from 2017 that looked at over 200 cases.
Yeah, that's a lot.
Yeah, and they used a laser electrocoagulation technique.
Okay.
And all the patients had rapid healing.
That's great.
And again, no incontinence reported.
This is starting to feel like a real game changer.
It has potential.
For people dealing with this.
Absolutely.
Are there any downsides or limitations that we should be aware of?
Well, it's important to remember that this is still a relatively new area of research.
Right.
We need more research, especially large-scale randomized controlled trials.
So it's not like a slam dunk yet.
Not quite.
But it's definitely something to keep an eye on.
Definitely.
This is all incredibly fascinating, I gotta say.
It is interesting.
I feel like I've already learned so much.
Good.
But what does it all mean for our listener? How can they apply this knowledge?
That's a good question.
What should they be taking away from all of this?
Well, let's think about your listeners' specific concerns.
Okay, let's make it personal.
So if they've already had surgery for fissures, or if they're really worried about incontinence, this Brazilian study and the others we've talked about, they offer some hope. Remember, some of them included patients who had already had surgery, and none of them had incontinence after LFT.
So even if other treatments haven't worked or are too risky, laser therapy might still be an option.
Yeah, it could be.
And the biggest concern is pain.
Yeah.
Which, let's be honest, it usually is.
Of course.
The pain reduction in these studies is really encouraging.
It is.
So it seems like this could be a game changer.
It's possible.
For people who are struggling with this.
Definitely.
So to kind of wrap up this first part of our deep dive, what are the key takeaways you want our listener to walk away with?
I think the biggest takeaway is that laser therapy for anal fissures shows a lot of promise for pain relief and healing.
Yeah.
And it has a good safety profile based on these initial studies.
That's great to hear.
And it's definitely something to talk to your doctor about.
Yeah, if you're dealing with this.
For sure.
Definitely something to keep on your radar.
Absolutely.
Now, we always like to leave our listeners with something to think about.
Okay.
A question to spark further thought.
I like it.
So here's one for you. Given this emerging evidence, would you consider exploring laser therapy as an option if you were facing an anal fissure?
That's a tough one.
It's a personal decision, of course.
It is.
And one to make after doing your research and talking to your doctor.
Absolutely.
But it's something to think about.
It is.
Remember, folks, informed decision-making is essential.
Absolutely.
When it comes to your health.
Couldn't agree more.
Keep asking questions, stay curious, and don't be afraid to advocate for yourself.
Well said.
We'll be back for part 2.
Looking forward to it.
To explore more about these different laser techniques.
Sounds good.
And what makes them tick.
Okay.
Stay tuned.
See.
Welcome back to our deep dive into laser therapy for anal fissures. I'm still kind of blown away by all that research we talked about in the first part.
Yeah, it's pretty amazing stuff.
Like lasers. Really. It's incredible what they can do these days.
It really is.
Makes you wonder what other medical breakthroughs are just around the corner.
It does, doesn't it?
But before we go too far down that rabbit hole, let's circle back to that Brazilian study for a second.
Yeah.
They focus mainly on pain relief.
Right.
Which is obviously a huge deal.
Absolutely.
For anyone dealing with fissures.
Of course.
Did they mention anything about, how long it actually takes for those fissures to heal?
That's a good question.
Like with the laser treatment.
Yeah.
Did they talk about healing time at all?
That particular study didn't go into too much detail about healing time.
Okay.
But other studies we've looked at do.
Right, like that 2017 review.
Exactly.
The one with over 200 cases.
That's the one.
What did they find? About healing times, I mean?
They reported that all the patients experienced rapid healing.
Rapid? Like how rapid are we talking?
Usually within a month.
Okay, that's pretty fast.
It is.
Especially compared to some of those other options we talked about.
Right.
So that's good news for anyone who wants to,
get back to normal.
Get back to their life, yeah.
Absolutely.
Speaking of those different laser techniques, you mentioned a few.
I did.
Like LFT, CO2 laser fractional, laser electrocoagulation.
Yes.
Are they all basically doing the same thing?
Well, they all use lasers. But they work in slightly different ways.
Oh, okay. So what are the differences then?
So LFT.
High-intensity laser therapy.
Right. That uses a high-powered diode laser.
Okay.
And it's delivered through a probe.
Okay.
That doesn't actually touch the tissue.
Okay, so it's not like burning or cutting.
No, not at all.
So how does it work then?
It works by stimulating those cellular processes we talked about earlier.
The
photobiomodulation.
Right, photobiomodulation, that's it.
Boosting energy production within the cells.
Okay.
Promoting healing.
Got it.
Now, CO2 laser fractional, that's a bit more targeted.
Okay.
It creates tiny channels in the tissue.
Oh, wow.
Which can break up scar tissue.
Interesting.
And encourage new tissue growth.
So it's kind of like, I don't know.
Like aerating a lawn.
Yeah, like a tiny laser drill. Making little holes.
To help it heal better.
Okay, cool. And laser electrocoagulation?
All right. That one uses a laser to heat up and seal blood vessels.
Okay.
It's often used to stop bleeding.
Makes sense.
But it can also be effective for treating hemorrhoids.
Oh, right. Hemorrhoids. We haven't talked much about those.
We haven't.
Do any of these laser therapies work for hemorrhoids too?
They do, actually. Yeah, laser therapy is becoming more popular for hemorrhoids.
Okay.
Especially for ones that don't respond to other treatments.
I see.
One of the articles you sent mentioned laser hemorrhoidoplasty.
Hemorrhoidoplasty.
It sounds intimidating.
It does.
But it's actually a minimally invasive procedure.
Okay.
Similar to how it works for fissures.
Yeah.
It uses laser energy to shrink and coagulate the hemorrhoidal tissue.
So it's kind of a 2-for-1 deal?
Exactly.
If you're dealing with both fissures and hemorrhoids?
Right.
Laser therapy could potentially address both.
That's a big advantage.
Especially since they often occur together.
They do.
It's all starting to make sense now.
Good.
But going back to the laser techniques for a sec.
Okay.
We've got LFT, CO2, electrocoagulation. Are there any other types of laser treatments out there that we should know about?
One of the sources mentions something called laser fissure treatment.
Okay.
Or LFT.
Wait, LFT. Isn't that the same as the high-intensity laser therapy?
It seems to be.
So maybe not a completely separate thing then?
Probably not.
Okay, so with all these laser options,
it
can feel kind of overwhelming,
I understand.
Like, how do you even begin to figure out which one might be right for you?
Well, the best advice is always to talk to a doctor.
Of course.
A qualified healthcare professional who specializes in these conditions.
Right, someone who really knows their stuff.
Exactly.
They can assess your specific situation, look at your medical history, all that.
And recommend the most appropriate treatment.
Okay, that makes sense.
Yeah.
But what about the practical stuff?
Like what?
Like cost and insurance coverage.
Ah, yes, the financial side of things.
Do insurance companies usually cover these laser therapies?
Unfortunately, it's a bit of a mixed bag.
Of course it is.
It depends on your specific insurance plan and where you live.
So basically, you got to check with your insurance company before you do anything.
It's always a good idea.
Nobody wants to get stuck with a huge bill.
No, nobody.
So let's switch gears a little bit and talk about what you, our listener, can do to prepare for a potential consultation with a doctor about this.
Good idea.
What kind of questions should you be asking?
Well, first and foremost,
Be open and honest with your doctor.
About what?
About your symptoms.
Okay.
Your medical history.
Even if it's embarrassing?
Especially if it's embarrassing.
Okay.
Your doctor needs the full picture.
To give you the best advice.
Exactly.
So need to suffer in silence or be embarrassed.
Doctors have seen it all.
They have, haven't they?
And be prepared to talk about your current treatments.
If you have any.
If you've tried fiber, warm baths,
okay,
medications, anything like that.
So basically give them a rundown of your, anal fissure journey so far.
Pretty much.
Okay.
And don't be afraid to ask questions about the different laser options.
Okay.
The benefits, the risks, the costs.
Yeah, all the important stuff.
Ask about recovery time.
Okay.
What to expect after the procedure.
What else?
Definitely ask about insurance coverage.
Right, we talked about that.
And any potential out-of-pocket expenses.
Good point.
It's all about being informed.
Yeah, being your own advocate.
So as we've mentioned, this laser therapy for fissures.
Yes.
It's still pretty new.
It is.
More research is needed, we know that.
Right.
But there are always new developments and studies coming out.
That's true.
So how can our listeners stay up to date on the latest findings?
Good question.
Like, what resources would you recommend?
Well, it's important to stick with reputable sources.
Okay, like what?
Medical journals are a good place to start.
Okay, any specific ones?
Well, the one that published the Brazilian study we talked about.
Yeah.
The Journal of Lasers and Medical Sciences.
Okay, that's a mouthful.
It is a bit technical.
Yeah, I was going to say probably not light reading.
No, not exactly.
But about something a little more, user-friendly.
There are organizations like the American Society of Colon and Rectal Surgeons.
Oh.
ASCRS for short.
ASCRS, got it.
They have websites with good information for patients.
Oh, that's helpful.
Summaries of research, guidelines for treatment.
So it's accurate, but still easy to understand.
Exactly.
That's good.
And, of course, always stay in touch with your healthcare provider.
Right, your doctors.
They can keep you updated on anything relevant to your situation.
It's a team effort.
It is.
Doctor and patient working together.
Absolutely.
So to wrap up this part of our deep dive, laser therapy, lots of potential.
Lots of potential.
But got to stay informed.
Absolutely.
Talk to your doctor.
Yes.
Ask questions.
Good advice.
Be your own health advocate.
Well said.
Now, for a final thought-provoking question.
Okay, hit me.
Imagine a future where laser therapy becomes like the standard treatment.
Okay.
For anal fissures.
The go-to option.
Yeah. What ripple effects do you think that would have?
That's interesting.
For patients?
Yeah.
For healthcare systems? For society?
It's a lot to think about.
It is, right?
We'll explore that further in the next part of our deep dive.
Stay tuned for part 3. We're back for the final part of our deep dive on laser therapy for anal fissures. It's been a wild ride.
It has.
We've covered so much ground.
Yeah, from the science to the practical stuff.
Even how to talk to your doctor about it.
Right. All the important things.
But now I think it's time to,
zoom out.
Yeah, get really big picture.
I like it.
And think about the future.
Okay.
At the end of part 2,
yeah,
we left our listeners with that question.
That thought-provoking question.
About what if laser therapy became like the standard of care?
The go-to treatment.
For anal fissures.
It's a big idea.
It is, right?
Pretty radical, actually.
Yeah, but exciting too.
Definitely.
So let's dive into those potential implications.
All right.
What changes might we see for patients?
Okay.
If laser therapy was the main treatment?
Well, I think the biggest thing is faster healing.
Okay.
Less pain.
Right.
Lower risk of complications.
Like incontinence.
Exactly.
That's huge.
It would be a massive quality of life improvement.
For so many people.
Absolutely.
It's like a whole new way of thinking about this condition.
A paradigm shift. Almost.
But it's not just about individual patients, right?
It's not. There are bigger implications.
For healthcare systems.
Exactly.
So what kind of shifts might we see there?
Well, if laser therapy is more effective.
Yeah.
And less invasive.
Right.
We could see shorter recovery times.
Okay.
Fewer complications after treatment.
Less strain on healthcare resources then.
Exactly.
Fewer hospital stays.
Right.
Follow-up appointments.
Yep.
Less need for pain meds.
All of that.
It's like a ripple effect of efficiency.
I like that. A ripple effect of efficiency.
And maybe even lower healthcare costs in the long run.
Potentially, yes.
But there's also,
the societal impact.
Right, how we view and talk about these conditions.
That's a really important point.
We've talked about the stigma.
The embarrassment.
People might not seek treatment because of that.
Unfortunately, that's true.
Delaying diagnosis, making things worse.
It happens.
But imagine if laser therapy became so normal.
So accepted.
That it helped to normalize the conversation.
That would be amazing.
No more hiding.
Right.
Feeling ashamed to get help.
Exactly.
Earlier diagnosis, treatment.
Preventing unnecessary suffering.
It's like creating a more supportive environment.
Absolutely.
More understanding.
Then who knows?
Yeah?
Maybe it could even lead to more research.
In other areas of medicine?
It's exciting to think about.
It really is. It's like opening up a whole new world of possibilities.
I agree.
But even with all this excitement,
yes,
important to remember,
we still need more research.
Laser therapy for fissures is still new.
Relatively new, yes.
Long-term effects, best practices, all that.
Still need to be studied.
Can't get ahead of ourselves.
Right.
But a little optimism never hurts.
It doesn't.
Especially when the early results are so positive.
They are encouraging.
So as we wrap up this deep dive,
okay,
what are the key takeaways for our listener?
The big picture message.
What do you want them to remember?
I think the most important thing is that anal fissures are treatable.
And common.
Very common.
So you're not alone if you're dealing with this.
Definitely not.
Don't suffer in silence.
Talk to a doctor.
Get the help you need.
There are solutions out there.
And laser therapy is one of them.
A potential game changer.
So stay informed.
Ask questions.
Be your own advocate.
Couldn't have said it better myself.
Your health is worth it.
It is.
That's some great advice.
Thank you.
And remember, this is just the beginning of your journey.
It is.
Keep researching.
Keep learning.
Keep asking questions.
Stay curious.
Thanks for joining us on this deep dive.
It's been a pleasure.
We'll be back soon with more fascinating topics to explore.
Until then, take care of yourselves.
And each other.
Goodbye, everyone.